I never really thought too much about it, but I definitely did think that you had to have more of a serious operation to have your eggs frozen. I sort of imagined them cutting into you, when actually it's not that at all. So if you don't have any choice like me so much, I would definitely recommend doing it. And actually, if you maybe you're just not thinking about kids yet, maybe you're 30 and you want to have a bit more time and you've got the money to do it, I think it's definitely worth doing, because it's just that ease of mind. It's just something that I now don't have to really worry about too much, because I've got a backup in store.
That was one of our guests, Abby, talking about her decision to freeze her eggs ahead of starting cancer treatment. And we're really pleased to have PharmaSure sponsoring the Fertility podcast once again, because if you're planning to have your eggs frozen, you want to make sure they are the best they can be. And you know that we always want to make sure you have all the information we need. So we wanted to tell you a bit about Impril from PharmaSure.
I think Impril is super, and I use it with a lot of my patients. It really helps with egg quality, and it keeps that really important DNA, or if you like, the genetic information in the egg, really intact, and it helps to ensure that the right genes are expressed. I think it's worth taking Impril for around kind of up to 3 months leading up to freezing your eggs.
And if you want to find out more, just visit fertilityfamily.co.uk. Now, you know, on the Fertility Podcast, we're always on a bit of a mission to empower you with what you can do at home. And in light of all that's been going on, we've had lockdown, the clinics close and reopen, but we still know that there is this kind of delay in things starting up for you. So we want to remind you of home testing.
And the great thing about MediCheck's tests is that it really doesn't matter where in your fertility journey you are. You might be at the beginning of your fertility journey and wanting to find out a bit of information about your fertility, or you might be about to start on fertility treatment and want to get all the tests done prior to starting your treatment. And therefore, these tests are great because you can use them at various different times.
Thank you again to MediCheck for continuing to sponsor the podcast. They have this range of simple home blood tests developed with our very own Kate Davis. So just visit medichecks.com to find out more. Welcome to the Fertility Podcast. I'm Natalie Silverman, your host. I've been using my voice in my work for about 15 years now. I used to be on the radio. Now I'm podcasting and do a lot of voiceover work. Now, the Fertility Podcast has a whole host of episodes for you, from adenomyosis to zero sperm. It's a total A to Z of all sorts of things that affect you on your fertility journey. I'm mum to a little boy called Phoenix after having successful ICSI treatment, and that was my reason for starting the podcast. And I hope that if you found us, then you'll realise that you are not alone. This podcast is to help educate and empower you. I've brought together as many experts and tried to share as many of your stories as possible. And I now have my wonderful co-host.
I'm Kate Davis, a fertility nurse consultant, and I'm adamant that we can all do so much better at understanding our fertility. I'm really passionate about teaching you to take ownership of your fertility, teaching you practical steps, emotional coping strategies, and lifestyle changes that you can make to hopefully optimise your chances of conceiving.
Now you know who we are. All you need to do is enjoy the show. So welcome to another episode of the Fertility Podcast. Kate and I are really looking forward to this conversation. We're speaking with Carole Gilling-Smith, who is the medical director of the Agora in Brighton. Well, it's in Hove, actually, and I purposely do that just to be able to do the Hove, actually. And one of Carole's patients, Abby Schindler. We're going to be hearing Abby's journey so far. So before we start, let's introduce the two of you to the podcast. How are you both?
Hi, good, thank you.
It's another podcast in lockdown where we're kind of staring at one another, and it's always quite surreal that we can't actually do this in person. Now, Carole, we've worked together in the past, and I know about the vast work that the Agora do, and one area that we were keen to talk about was the work you do in terms of fertility preservation, and it's something that we were wanting to capture and to highlight to people, how it can kind of fit in to the different things and events that happen in our lives. Do you want to just tell me a little bit about how the Agora works with your community in terms of fertility preservation?
Yes, Natalie, we do fertility preservation for two main groups of patients: those that have an urgent need, who've just been diagnosed with something like cancer where they haven't got a very long time to put away sperm or eggs before they start their treatment, which may or may not have an impact on their fertility. And examples are breast cancer, testicular cancer. And these are funded to a large extent by the NHS in Sussex. We're very lucky. So they have a chance to come in and freeze sperm or eggs and then move on to their treatment. And the other group of patients we work with are those that are going to take, perhaps it's not so urgent, but they're going to take some form of medication, which we know may potentially damage their fertility and their chances of being able to have a child in the future. And that's very often patients that are transitioning, going through gender reassignment, and they are at the point where either the main hormone that produces sperm, testosterone, or eggs, estrogen, is going to be suppressed, or they're going to have the other hormone. So they're going to have testosterone if they're transitioning to be a man. And we know that's going to damage, obviously, egg quality, or in the case of sperm quality. So they too, most recently, have been given NHS funding, which is fantastic. So those are the two main groups of patients. We are starting to see a few patients who are trialing therapies for multiple sclerosis coming through to preserve their fertility, which is an interesting new group.
That's really interesting. Yeah,
yes.
Fascinating.
We actually have recorded a podcast together. It's called the Agora Journals. And in that series, which I'll make sure there's links to in the show notes for this episode, there are 2 conversations about fertility preservation with a trans man and a trans woman. So I'll make sure that you can hear those, because I think it's really interesting to hear those stories as well. But today we're talking about fertility preservation specifically in terms of ahead of cancer treatment. We're going to welcome Abby to the podcast to talk a bit about what's been going on. Abby, you're 25, right?
Yeah, 25.
And the whole thought process about your fertility, having a family, has that been in any way front of mind for you?
Before cancer, no. I'm not in a long-term relationship. I only moved out of my mum's, 2.5 years ago. So it was almost feeling like the start of my life, and in that respect, and being really independent, and kids was definitely not something I was thinking of within the next 5 years. And I think the minute you're diagnosed with cancer, obviously I had no idea that it could affect your fertility, and then it was all of a sudden something that I had to think about. And I think at the end of the day, the simplest choice was to make a choice now that would enable me just to have choices later on, even though it's not something that I'm thinking about now. And it's not something that I know I'm definitely going to want, but it's something that was pushed upon me to make a decision about now. And thankfully now I have that choice that I can actually make later on, which is really good, because I didn't know about it at all before I was diagnosed.
How did it come to your mind then? Or was it your doctors that they recommended it at that time when you were faced with your diagnosis? Or how did it then become forefront of your mind? What triggered that?
I think, it was the meeting that I had when they told me my diagnosis, and I can't remember if it was my mum, because she was in the room as well, or if it was one of the doctors who spoke about fertility. I know it was my mum who asked if we could have genetic testing done, and then I think maybe it was my Macmillan nurse who said, and we can do fertility as well, and that was when I found out about it.
So just to explain, you were diagnosed with breast cancer.
Yeah.
Is that something that there's been any genetic links? Anybody else in the family?
No, not at all. My great grandma had it, but that's too far of a gap for it to be classed as genetic.
How are you now then, Abby? What kind of, how far have you got through the process, and how well are you?
I'm doing really well, actually. So I had a lumpectomy and a node biopsy removal on the 27th of March, and thankfully that all came back clear in my nodes and the lump was completely removed. So they now say that I am cancer free. So that's something that is really good. It's definitely a weight lifted, but I think a lot of people, because I definitely didn't know that even if you're cancer free after surgery, you still have to go through chemotherapy. And because my cancer was hormone positive and HER2 positive, I've got to go through everything else, and I've got to go through hormone therapy, and it's just, I thought if you had it removed surgically, that was it. And I even asked them, do I have to go through everything else if it is removed? And they said yes, because it's just your best chance of survival afterwards. So it almost seems a bit surreal in a way, because you're diagnosed with cancer and then 6 weeks later I was told I didn't have cancer anymore. But you still got that burden on your life. So it's just such a strange scenario to go through.
And not only have you got to get your head around that, but all of this has kind of played out during lockdown. We're talking at the start of May. The podcast will be shared a bit later. So that whole process of life totally changing for what you are going through anyway has been kind of topped by this lockdown. To then have to go into a fertility clinic and have conversations with someone about your future family planning, how did that feel?
It was quite daunting, just because I'm not really a planner. I sort of take my life, as you're 25, as you do, I guess, a day at a time, a week at a time, a month at a time. And I didn't really know anything about it. I sort of came to my first appointment just thinking that I was going to have my eggs frozen, and that was kind of it. And actually, I was kind of surprised in the fact that it was that easy. And for me, it felt that easy. I just came to my appointments and I was talked to, and I was made to understand everything, but it felt so easy of a process to go through. So that actually really surprised me, because I was expecting it to be a bit more difficult, but it was, really easy.
So, Carole, I know that you put a huge emphasis on support at the Agora, and when you're talking with someone like Abby, she's 25, the emotional impact of what she's been diagnosed with and now has to think about is quite full on. Just go through how that kind of journey then happened, and the time frame from her coming in to having the egg collection, because it has to be done quite quickly, doesn't it? And we're doing it during lockdown.
Yes, so this happened, I think it was quite early on in March, we got the referral letter from Abby, and we're just moving into that sort of mid-March period where the HFEA haven't said you need to stop services. They haven't put clarity there. And we see Abby, we bring all cancer patients through within 48 hours of receiving the referral letter. And she sees one of my colleagues, and we're discussing the case. And, to me, there was no choice to be made. I said, whatever happens, we have to do this. This is a young girl, and we need to be able to have a plan in place and start this treatment. So she comes along, and we review always the medical history. We have a really good letter from the consultant oncologist. So we have a plan. The most important thing we need to know is when things are going to happen. Now with Abby, the scenario was more complicated, because usually the patient comes to us with a date for their surgery, and we know the breast tumour will be removed at that point, and usually there's a 6-week window, so they recover from the surgery before starting the chemotherapy. But I think with Abby, we didn't have any dates, did we, when you first came to the clinic? And we were working with, well, we don't know if we're going into lockdown. We don't know if she's going to have the surgery. We don't know if she's going to have the chemotherapy. And we don't even know if we're going to be able to do your treatment. So we had all these ifs and buts, which was a really unusual scenario. But I think we sort of handled it quite carefully. We mapped out the journey for her, allowing for the possible different case scenarios. And we said, right, as soon as you know the date that you're going to have the surgery, and as soon as they tell you you're recovered and you are fit to have your ovarian stimulation, we'll start it. So we needed to communicate that to the consultant oncologist, and then we had a plan, but it was based on this unknown date, because we didn't know if surgery was even going ahead at that point. And we know that the plan of treatment is always around about 2 weeks to stimulate the ovary. We can start at any point in a woman's cycle. We just start. And that's what we did with Abby. You just start and you stimulate the ovary as you would in an IVF cycle. And you're roughly 2 weeks later, you will be collecting the eggs. And that was really, really important to explain that to her. But the other thing that's really important in these conversations is we have to find out about Abby and what Abby wants to do. Some of our patients, usually a little bit older, are already in a relationship, perhaps married, and they need to start thinking about whether they're going to freeze eggs or have those eggs first fertilized with their partner's sperm. And if that's the case, we're freezing embryos. So we didn't really have so much of that conversation with Abby, because she's quite young and she was just freezing eggs. But these are all the other sort of case scenarios we need to consider. And we need to consider then with Abby, well, once we've got these eggs in the freezer, at a future date, how is it going to look like for you? What are we going to do with these eggs? And we have to explain to her how the eggs will be thawed out, what their chances of surviving are going to be, and how she could have a baby using sperm from a partner. So we explained to her that in general we would inject sperm into these eggs to create some embryos that we could then transfer into her womb. So I think there was an awful lot of information to take in, and all the ifs and buts to add to the complexity of that scenario.
Hello, it's me, Natalie. Sorry to interrupt. We will be back with Abby and Carole in just a moment. I just want to remind you to head over to my closed Facebook group, which is facebook.com/groups/talk fertility, because very soon I am launching this really great free 5-day challenge to help you with your emotional well-being. You don't want to miss it. Right, let's get back to the episode. How was that, Abby? I mean, talking about the actual baby making process in the lab, so to speak. And at that point, it's kind of taken away what you might assume a natural part of having a family. And I know from going through fertility treatment, that's a kind of a loss that you deal with when you have been, in my experience, from trying and then not being able to get pregnant naturally, and then going to have these kind of tests and these conversations, but it's all been thrust on you. Were you able to process that, or is that still bubbling away in your head?
I think I got the gist of it, but I'm sure there's so many details that went over my head, because I almost had to just zone in on what information was important now, because you're right, there's so much information that I was, that I had to go through and videos I had to watch, and I just couldn't take it all in, not just with the fertility, but with everything that was going on. It would be impossible for me to take in every bit of information. So I just kind of hung on to the bits that were relevant to what I was going through now. So like the egg collection and all that kind of stuff. And then I'll sort of revisit all the parts about actually having a baby, when that time comes, or when I think about that, because it's just so much to take in at once.
And that's really sensible, isn't it, Abby? Because your mind can only absorb a certain amount at a certain time, and therefore you've almost segregated what is important and then packaged away for another time what is important but less pressing right now.
Yeah.
With that in mind, where did you get your emotional support from? Who provided that for you? Did you seek professional support? Did you have support from friends and family? Where did you get that from, especially during lockdown? That's difficult.
Well, when we went into lockdown, my mum actually, she lives in London. She moved up and moved in with me, because we're both put on furlough. So she moved down so she could be with me for my surgery and through the egg retrieval process, and just look after me, as mums do. But that's kind of where I've got my support from, I guess. In a strange way, going through all of this and being on lockdown has helped in some ways, because I've got so many people there for me where I wouldn't usually. My flatmate, who's also my best friend, she would have been at work all the time. My mum would have only been able to come down on her days off, and in a way it's been able to make that a lot stronger by freeing up everyone's time.
It's a blessing in disguise.
Yeah, exactly, yeah.
Yeah, I think we're finding, aren't we, with lockdown, there's lots of positives that are coming out of it, and almost to the extent where you don't want it to go back to normal, because actually there's been so many great benefits.
And Abby, this might not be something that you've even thought about, and so feel free to just say I haven't thought about it if not. But the fact that now, like a future relationship, I suppose, is going to involve these types of conversations, maybe not sooner than you'd expect, because the first conversation when you're in your 20s, I don't know, for me it wasn't necessarily about having families, but it might be. Is that something that is causing any kind of I don't know, how do you feel about that? Because it's going to need to be a conversation, I suppose. Again, is that kind of parked for now about what a conversation with a partner might be?
It is a bit. I was always a bit uncertain anyway about having kids, because my mum, it took her 10 years to get pregnant naturally. Through trying. So I always had it in the back of my head that, I might not be one of these lucky ladies who gets pregnant, within a year or however it goes. So I kind of always had that in the back of my head. But like you say, at this point in my life, it's very much parked and stationary and waiting for that time. Now it's like, I think Carole said to me when I had my surgery, it's 50-50, now with chemotherapy, if you can have a child, but the odds are a lot better than they were. So I'm not too worried about it, but I think I'll just have to worry about it when it comes and when I have to have that conversation. But like you said, it's a conversation you thought you'd never really have to have, and now it's something I'm thinking about before even trying to have children.
Do you want to just elaborate on the odds there, Carole?
Yes, so part of the conversation we have with people who come like Abby is about their options, because what I didn't mention before is that she's got a hormone sensitive tumour, breast tumour, which means you've got to talk through, is delaying your chemotherapy going to worsen your outcome? And so we work out what the plan is for her, and there didn't seem to be in her case a particular time pressure. And would doing hormone stimulation worsen your outcome? So we have to explain that we use a drug called letrozole to suppress estrogen levels during the ovarian stimulation, because we're not obviously needing to have that estrogen around, because we're not doing an embryo transfer. So yes, it's perfectly safe to do this treatment. It won't make your odds any different in terms of outcome after treatment for your breast cancer. But what is the chance of you losing your fertility? And that's very age dependent, actually. So knowing that Abby was young and had good eggs, good egg reserve on the picture that we took, we did some hormone tests and scans, it was very reassuring. I mean, I could say to her, look, there's a good chance you're going to never need to use these eggs. You'll be able to conceive naturally, particularly in young women. Recovery after breast cancer chemotherapy it's a good chemotherapy to have. Some of the more aggressive chemotherapies are those for the blood tumours like leukemia, lymphoma, are more aggressive, but breast cancer is a good one to have, particularly as they're not going to plan a long-term chemotherapy. But the problem with Abby is that maybe they're going to say to her, look, it is hormone sensitive, perhaps you should stay on this drug tamoxifen, you may not be able to have children for a period of time. So there's those little unknowns about being pregnant that we had to go through with her, just so that she was aware of those potential risks. But I think that, I totally agree with Abby. It's like so much information's going on at that particular point of diagnosis. We try to break it down into manageable pieces of information. I think follow-up is really important with fertility preservation. So I always say to patients, look, when this is over, get in touch. We can have a bit more of a conversation just to reassure you and so forth.
And Carole, on that note, how did you address the success rate using frozen eggs with Abby when you were talking about fertility preservation?
Really, we talked, I think we always talk in terms of what knowledge have we got at the moment if you freeze your eggs in 2020. The process for freezing eggs really improved once vitrification became available. So the information we've got about eggs, how well they survive and how likely they are to lead to a live birth, has come in the last 8 years. And it's come predominantly from donor egg banks. I mean, that's where we see eggs frozen a lot and being used a lot. And it's come a lot from those countries where they've used egg freezing, such as Spain and Italy and the States. So I can't give her figures from the Agora Clinic where we've done very little thawing out of eggs. We've done some, but it's not the same large numbers. So she will have been told, I think she saw my colleague, Dr. Collada, she will have been told that realistically, if you're under 35 when you freeze eggs, if you freeze 20 eggs or more, statistically 85% chance of a live birth. That's a really quite a good chance. If the egg quality is good and you're young, as she is, relatively similar figures. But it's the patients that come to us a little bit older, sort of 39, 40, we really do have a much lower statistic. And I think people have to be realistic. And it's in the older age group who are often settled down, have already got a long-term relationship, have been thinking about having children, that I start to talk to them about the benefit of freezing embryos, where we know survival is going to be much better.
Abby, I was wondering whether, having gone through this and now talking to your girlfriends predominantly about the fact that you've frozen your eggs, whether that sparked a conversation with them about egg freezing.
Not really. I think they're all just a bit like, they don't really know what it entails. They don't really know what it's about. They were kind of just sort of in awe that I managed to inject myself. I think that's all that they were really thinking about, because everyone my age, you just take life day by day. I think we have a couple of friends that have kids, but it's not a huge thing in any of our lives at the moment. We're all still very much like independent. None of us have really settled down. Some of us are in long-term relationships, but not thinking about kids anytime soon. So it really hasn't come up that much.
Do you feel now, though, you said you couldn't believe how kind of easy it was?
Yeah.
Not that I'm suggesting that you become this big advocate for freezing eggs, but do you feel that the fact that, because there is a bit of a gap in that fertility education around, your age group, and do you feel now that it might be a conversation that you help people know that it's not such a hard thing to do, as long as there's ways and means to get it done, and maybe it is something, because we want people, especially women, to understand more about their fertility, and sadly you're often not having to face these things until you don't have a choice. Do you think that it might spark more chats about this topic?
I think so. I think I never really thought too much about it, but I definitely did think that you had to have more of a serious operation to have your eggs frozen. I sort of imagined them cutting into you, when actually it's not that at all. So if you don't have any choice like me so much, I would definitely recommend doing it. And actually, if you maybe you're just not thinking about kids yet, maybe you're 30 and you want to have a bit more time and you've got the money to do it, I think it's definitely worth doing, because it's just that ease of mind. It's just something that I now don't have to really worry about too much, because I've got a backup in store. So it's worth it. I think the biggest thing is really just going to get scans every other day. But in terms of, taking the injections and having the procedure, it's all very minimal. I think the biggest side effect I had was bloating and like feeling like I had a cramp, which was, thinking the long term of what you can get out of it is just such a small thing to go through.
Carole, is there anything you'd like to add in terms of, the whole conversation around egg freezing? We know the storage limit has been extended during lockdown, so we've kind of got 12 years now, haven't we, rather than the 10. So that gives people a bit more time. So Abby maybe not having to think about it till she's 37. But any last thoughts from you?
Just remember that if Abby had lost her fertility as a result of the treatment, she does have the possibility of 55 years of freezing. That's the law. So,
right.
That, I think for her, in her case, where she might have that situation because I don't know, long-term hormone treatment or something. But I think the law is likely to change on egg freezing. And I think I am talking to a whole new generation of young people who are becoming fertility aware. I mean, the last 15 years of my professional life, I've seen many single women go onto a solo motherhood journey. I think the sperm is becoming less relevant, and people are starting to actually think, I want this out of my life. And it doesn't matter if I'm a bit younger, I want this out of my life. I want a child, and it's complicated. I've had relationships and it can be complicated, and I want a child. So I think we're going to see more women thinking about egg freezing for that sheer ability to have the independence to be able to do something when the time feels right.
I think you meant the partner is less relevant rather than the sperm.
I was going to say, we still need the sperm.
The sperm is key.
I meant the partner. By me mentioning the sperm, the donor sperm can be used, but the partner, yes, the partner is less relevant.
We know what you meant. Carole, thank you as always for your time. Abby, you're so positive, and I love that, and I wish you the best of luck with starting the treatment, and thank you so much for sharing it with us, because what we always want to do is just offer hope to people that listen to the podcast from everybody's different experiences, and I think that your whole approach to it is really admirable. So thank you.
Good luck, Abby.
Thank you very much.
Thanks. I mean, what was so exciting was that the NHS delivered. We were being told, well, surgery is on hold, cancer surgery is on hold, chemotherapy is on hold. And I was just overwhelmed with joy when, you said, no, we've got to have the surgery and we've got a plan in place. And I was so pleased that despite everything that's going on around us, here we have, a lovely ending to the story. Because I know you're going to be fine, because you're in a really good place, you're a strong person, and they've got all the treatment on board for you, which is great. And we've got some lovely eggs in the freezer for you. We've told you that. So that's really good.
Great. A happy ending.
A happy ending. Make sure you check out the show notes for this episode at thefertilitypodcast.com or via your favourite podcast app. Be sure to rate, review, subscribe and share because we love hearing from you and whilst you've got your phone in your hand. Remember I said about that closed Facebook group? Just to remind you of it because I'd love to see you in there. It's facebook.com/groups/talkfertility. See you there.